Hi, I'm Anoba.
Hi, I'm Chidima. Today we'll be discussing infertility. It's such a sensitive one that bothers a lot of people in the society, and we thought it wise to discuss this and by so doing help couples who are facing this challenge get answers to their questions. So, Anoba, what really is infertility?
So infertility is the inability of a couple to obtain pregnancy after 12 months of having adequate unprotected sexual intercourse.
Wow, adequate?
Yes, adequate, because a couple needs to have at least 3 times of sexual intercourse to qualify as infertile. We had a case where a lady came to the consulting room, and the problem is that she's not able to achieve pregnancy. So upon speaking to her, we realized that the husband is actually outside of the country, and it's only when the husband comes that they engage in sex. And once you are not having a regular sex, then you may be unable to have a pregnancy.
Wow. So we do have different types of infertility. The primary infertility is a case whereby a couple have been unable to achieve pregnancy after 12 months of adequate unprotected sexual intercourse. And for the secondary infertility, this is a situation whereby a couple has previously achieved a pregnancy but currently are unable to achieve a pregnancy after 12 months of adequate unprotected sexual intercourse. We have a subdivision known as the voluntary infertility. In this situation, a couple has taken measures in order to prevent pregnancy from occurring, such as any form of contraception.
Yes, this is true, because we had a client again who had actually inserted an IUD and had forgotten about it. And once you have a contraception inserted or you are using any contraception, there is no way you can achieve a pregnancy. Now, the single most important factor in determining fertility is the age of the female partner. When the female partner is 35 years or above, fertility is halved. Fertility declines sharply after the age of 37 years.
The female partner tends to be blamed when issues of infertility arise in marriage, but it's important to know that 40% of the causes of infertility are due to the male factors, and another 40% are due to the female factors. And we also have a 10% case when the male and the female partner contribute to the cause of the infertility. And we also have the 10% whereby no specific cause of the infertility is found. Now, before we go ahead to discuss the causes of infertility, first we have to understand the process of fertilization that leads to pregnancy. This is a schematic representation of the female reproductive system with a penis inside the vagina. As you can see, this is the penile shaft. We have the vagina. This is the cervix of the female reproductive system. We have the uterus, commonly known as the womb. We have the fallopian tubes and the eggs. In order for pregnancy to be achieved, there has to be a sexual intercourse. Of course, there has to be. So during sexual intercourse, when an orgasm is achieved, the semen with the sperm is released around the cervix. Now, there are fluids produced in the cervix, known as the cervical mucus. It has to be friendly for the sperms to be able to survive and travel through the womb to the fallopian tubes. Now, the fertilization occurs in the fallopian tubes, and before this is successful, a woman must ovulate to release an egg that the sperm will meet just in the fallopian tubes for fertilization to occur. And after fertilization takes place, the fertilized egg has to travel into the womb and is implanted on the wall of the uterus for pregnancy to be achieved. So if any of these processes is affected, pregnancy will not be achieved. If a woman has a problem with ovulation and she's unable to produce an egg for the sperm to fertilize, pregnancy will not be achieved. Also, in cases of tubal blockage, either due to past history of sexually transmitted infection, there will also be inability of the fertilized egg to move into the womb and be implanted for pregnancy to be achieved. Also, in cases such as uterine fibroid, this fertilized egg might not be able to implant in the womb, and therefore pregnancy will also not be achieved. Now, like we earlier stated, we need healthy, viable sperms in order to achieve pregnancy. And even though a lot of sperms are produced, about 500,000 sperms are needed for a successful pregnancy to be achieved. It's only one sperm that fertilizes the egg.
So some of the male factors that causes infertility includes disorders of sperm formation. God, in his own wisdom, made the male scrotum to hang out of the body so that the temperature of the scrotum is 1 degree Celsius less than the body temperature, so that it will help with the formation of the sperm. Secondly, in long distance drivers, because they sit at one place and again they sit on their scrotum, the temperature in that area is very high, so preventing the formation of healthier sperms. Also, in people who wear tight-fitting underwear, they are also unable to have good sperms to fertilize the egg.
That brings me to this point. I really advise my clients to let the scrotum rest. When you're home, you can sleep naked, and also avoid very hot baths for clients who already have infertility issues. As much as possible, have cold showers, because hot showers could also increase the scrotal temperature, therefore affecting the quality of sperm production.
So Chidima, any signs and symptoms of infertility?
Oh no, there are no signs and symptoms of infertility. And that also brings me to this point. We have clients who come to us, sometimes even before marriage, requesting to have a specific test done to know if they are fertile or infertile. There is no one particular test that could tell if a woman or a man is fertile. The true test of fertility is achieving pregnancy. So we can run a whole lot of tests in evaluating a patient who we think is infertile. So, Anoba, if a couple have had unprotected, adequate sexual intercourse in the last 12 months and are still unable to achieve pregnancy, what should they do?
So they should kindly visit a gynecologist for evaluation. If the need be, they will be referred to a fertility specialist for treatment.
We have several modalities of treatment depending on the cause of the infertility. For the specialized treatment, we have the hormonal therapies. We also have the ovulation induction for clients who have problem with ovulation. We have other methods such as the intrauterine insemination. We have the in vitro fertilization. We also have the egg and the sperm donation, and also surrogacy for patients who are unable to carry their own babies. At this point, I hope we've been able to successfully answer some of your questions. So if you have a problem with fertility, do well to visit your gynecologist. My name is Chidima.
And my name is Anoba.
We'll see you next time.